Welcome. I'm Integrative Neurorehabilitation Specialist Dr. Douglas Wingate. This video is for anybody who's been living with chronic pain, particularly fibromyalgia, widespread pain, or the kind of pain that defies straightforward explanation, and for the providers who care for them. I want to introduce a concept that is transforming how we understand chronic pain, and a treatment approach that addresses it at the foundational neurological level, Neurogen brain balancing. Let's first talk about the scale of what we're looking at here. Chronic pain affects over 50 million adults in the United States, more than cancer, heart disease, and diabetes combined. Of those, 17 million live with high-impact chronic pain, meaning that their pain substantially limits their life or work activities on most days. Over 4 million Americans have fibromyalgia, a condition that takes an average of 5 years to even diagnose, and that affects biological women 2 to 3 times more than men. And the annual economic cost of chronic pain in this country, combining direct medical costs and lost productivity, exceeds $635 billion. Behind those numbers are millions of people who have tried everything, been dismissed by providers, been told that their pain is in their head, which, as it turns out, is closer to the truth than anyone intended. Because chronic pain, especially central sensitization and fibromyalgia, genuinely does, to some extent, live in the brain. And understanding that is the key to treating it. This is the most important conceptual shift in pain medicine in the last few decades. Central sensitization is when the nervous system amplifies pain signals far beyond what any actual tissue damage warrants. The volume control in the brain is turned up too high, and it won't turn back down. This isn't imaginary. It's measurable, neurological, and directly targetable. Central sensitization produces a specific constellation of symptoms. You have allodynia, normal, non-painful stimuli, like light touch of clothing or temperature changes, are experienced as intensely painful because the sensory threshold is collapsed. Hyperalgesia, normal painful stimuli produce pain far beyond their intensity. Widespread pain, the sensitization is central, meaning that it spreads throughout the body regardless of where any original injury happened. Non-restorative sleep, the alpha-delta sleep anomaly, a specific EEG finding where waking brain rhythms intrude into deep sleep, preventing the restorative processes that normally regulate pain sensitivity. And cognitive symptoms, the same dysregulation that amplifies pain, disrupts focus, memory, and mental clarity, producing the brain fog that so many chronic pain sufferers know all too well. And mood disruption, depression and anxiety are neurologically intertwined with chronic pain, sharing many of the same mechanisms and dysregulation of the autonomic nervous system that drives the pain itself. For those who have been told these symptoms are separate problems or that the connection between them is psychological, this framework explains the entire picture as a single, unified neurological state. Here's the neurological evidence. Chronic pain leaves measurable, consistent signatures in the brain's electrical activity. These aren't incidental findings, they're the neurological substrate of the pain itself. The dominant framework is thalamocortical dysrhythmia. In a healthy brain, the thalamus and the cortex communicate through oscillatory loops operating primarily in alpha and beta frequencies. In chronic pain, thalamic neurons that have lost normal sensory input shift into a pathological theta range burst firing. This slow wave signal propagates to the cortex, suppressing alpha rhythms that generates the characteristic pain amplifying EEG signature. What does that look like on an EEG? You have increased theta power, one of the most replicated findings across fibromyalgia, neuropathic pain, and chronic musculoskeletal pain. It's directly related with ongoing pain and fatigue. There's reduced alpha power, especially over the somatosensory and the parietal areas, reflecting the loss of cortical inhibitory drive that normally regulates pain signals. There's elevated high beta and gamma hyperconnectivity. The brain's pain circuitry is stuck in a state of amplified vigilance. The alpha-delta sleep anomaly mentioned earlier, where alpha waves intrude into deep delta sleep, which is found in more than 75% of fibromyalgia patients, and prevents restorative sleep, perpetuating the entire central sensitization cycle. An altered peak alpha frequency, slowed alpha in chronic pain that predicts both pain severity and treatment response. These patterns are measurable. They are consistent across multiple independent research groups, and they are treatment targets. Most chronic pain treatments were designed before the central sensitization model was established. They target the wrong level of the nervous system. Medications like opioids, NSAIDs, anticonvulsants, and SNRIs address the neurochemistry downstream. They don't normalize the thalamocortical dysrhythmia that's generating the pain signal. Intolerance, dependence, and cognitive side effects are well-documented limitations. Physical therapy addresses peripheral tissue and movement, critically important but insufficient when the primary driver is the central amplification rather than ongoing tissue damage. Cognitive behavioral therapy and pain psychology can improve coping and catastrophizing, genuinely valuable, but require active cognitive engagement by those who are already cognitively fatigued by their condition. Invasive procedures like nerve blocks and spinal cord stimulation can offer relief to some, but their risks, costs, and limited durability make them inaccessible to most people with diffuse central sensitization. The missing piece has been a direct, non-invasive intervention that targets the dysregulated brain rhythms driving the central amplification. That is precisely what Neurogen brain balancing offers. Let's look at each major EEG signal of central sensitization to a corresponding Neurogen effect. We have thalamocortical dysrhythmia and theta overdrive. The core mechanism of chronic pain amplification is addressed by Neurogen's documented ability to reduce pathological slow wave activity, directly targeting the thalamic burst firing pattern that generates abnormal pain signals. With reduced somatosensory alpha activity, the lost cortical inhibitory drive, this is addressed through EEG-guided upregulation of individual alpha power, restoring the brain's natural pain modulating system. With high beta hyperactivity, the over-synchronized pain circuitry, this gets quieted by neuromodulation's reduction of pathological beta overdrive. The alpha-delta sleep anomaly is addressed through rebalancing the autonomic nervous system and oscillatory regulation that supports restoration of deep, restorative sleep, breaking the pain-sleep deprivation cycle. Speaking of the autonomic nervous system, when it's in sympathetic overdrive, it lowers pain thresholds and sustains hypervigilance. This responds to vagal modulation that promotes parasympathetic recovery. And critically, the comorbid depression, anxiety, and cognitive fog that so often accompany chronic pain share the same thalamocortical mechanisms, meaning that Neurogen's oscillatory rebalancing addresses all of them simultaneously through the same intervention. This is the clinical power of targeting the central mechanism rather than individual symptoms. Neurogen brain balancing is described in the peer-reviewed literature as a novel, passive, non-invasive neurobiomodulation modality for brain health. There are 4 features that make it particularly suited for chronic pain sufferers. First, it's fully passive. There's no active tasks, no cognitive demand, no pain-provoking physical effort. Clients come in, sit down, and rest. This is ideal for those whose fatigue and sensitivity make active interventions intolerable. For fibromyalgia sufferers especially, the absence of any exertion or performance demand is significant. Second, real-time EEG guidance. Live brainwave data drives every session. The system reads current theta burden, individual alpha frequency, and pain network coherence, and generates a protocol that responds to what it actually finds. Third, lip test microcurrent signaling. Ultra-low intensity transcranial electrical signaling, orders of magnitude gentler than transcranial direct current stimulation, provides key brain areas a reference for restoring normal communication. And fourth, central mechanism targeting. Unlike virtually every other pain intervention, Neurogen operates directly at the central nervous system level, addressing the thalamocortical dysrhythmia that is the neurological root of chronically amplified pain. The evidence base here is among the strongest in the neurofeedback field. The headline finding in a peer-reviewed research published in Frontiers in Pain Research and confirmed in a 2024 randomized controlled trial in the Journal of Pain. More than 50% of chronic pain sufferers who upregulated alpha or downregulated high beta frequencies achieved clinically significant pain improvement of 30% or more, alongside improvements in central sensitization inventory scores, sleep quality, depression, and quality of life. Supporting that, a 2025 study published in the European Journal of Neurology showed that 12 EEG neurofeedback sessions over 4 weeks targeting the alpha-theta ratio showed significant pain-reducing effects in peripheral neuropathy sufferers. The Frontiers in Pain Research 2022 and 2025 studies specifically showed significant reductions in central sensitization inventory scores after EEG neuromodulation, indicating measurable neuroplastic changes and reducing sensory hypersensitivity. The fibromyalgia literature confirms that increased prefrontal theta points specifically to therapeutic interventions aimed at normalizing neural oscillations. In the 80 veteran Neurogen cohort published by Drs. Cassian and Turetsky in 2025, chronic pain was among the most commonly reported improvements alongside PTSD, sleep, and cognitive function, consistent with the shared thalamocortical and autonomic nervous system mechanisms. Strong candidates for this approach include a wide range of chronic pain conditions. Anyone with central sensitization syndrome, whether primary or secondary to another condition, fibromyalgia at any severity, chronic neuropathic pain of peripheral or central origin, chronic musculoskeletal pain with evidence of central amplification, medication-resistant or medication-fatigued individuals, which is a very large proportion of the chronic pain population, those with comorbid sleep disruption, fatigue, and brain fog, those with comorbid depression, anxiety, or PTSD, and anyone actively seeking a drug-free or adjunctive approach to pain management. A few important considerations. This video does not replace neurological or rheumatological evaluation. Chronic pain requires appropriate medical workup. Ongoing tissue injury needs concurrent appropriate care alongside Neurogen. The standard contraindications apply. Active seizure disorder requires pretreatment consultation. Implanted devices need individual review. Neurogen integrates well alongside physical therapy, medication management, cognitive behavioral therapy, acupuncture and body work, and pain psychology. And one specific consideration for this population, results are cumulative, and expectation setting around treatment timeline is particularly important for those who have often experienced disappointment with other interventions. Central sensitization is a neurological reality, measurable in the brain's electrical patterns, and increasingly targetable through EEG-guided neuromodulation. Neurogen brain balancing targets those patterns directly, offering a safe, evidence-informed, drug-free path toward genuine pain reduction and restored quality of life. To learn more or to schedule a consultation, visit acuneuromodulation.com. Veterans can access 4 free sessions through the nonprofit bb4vets.org.